Welcome to this risk management presentation, COVID-19 and holding in-person meetings, which will last approximately 15 minutes and will, as the title suggests, focus on in-person meetings. Notwithstanding the plethora of advice and guidance relating to COVID-19, lockdown and gradual easing of restrictions, there is much uncertainty about what can or cannot be done. There are questions relating to interpretation of guidance, and there's concern about doing the right thing. Before we start, a little background information. My name's Brian Harding. I work for Gallagher Risk Management Solutions, and like Cayman Company, part of Gallagher, a global insurance, risk management and consulting services company. I'm a risk management consultant and Northern team leader, managing a team of 7 consultants. I am an associate of the Chartered Insurance Institute, a chartered insurance risk manager, a member of the International Institute of Risk and Safety Management, and a technician member of IOSH, with over 40 years experience in insurance and risk management. Let's face it, in-person meetings are going to happen, so let's make them safe. This webinar will look at legislation and guidance, risk assessments, hierarchy of control, why in-person meetings, controlling the risks and becoming COVID-19 safe, an NALC and SLCC checklist, the what, why, and the how. To provide you with information on in-person meetings, how they might be allowed, what you currently can and cannot do, and the risk management perspectives, and how due consideration to the risks and mitigating actions in-person meetings might be arranged. Legislation. All health and safety legislation in place prior to COVID-19 continues to apply, unless modified by coronavirus COVID-19 specific legislation. Reference should be made to the duties imposed by, for example, Health and Safety at Work, etc. Act 1974, an enabling act with many subordinate regulations, rules and orders, which include the Management of Health and Safety at Work Regulations 1999 as amended, Control of Substances Hazardous to Health Regulations 2002, and the Reporting of Injuries, Diseases and Dangerous Occurrence Regulations 2013, all of which have specific significance during this pandemic. COVID-19 specific legislation includes the Coronavirus England Act 2020, intended to provide relief from the disruption caused by the coronavirus outbreak. The UK's government clear's commitment is that none of the provisions will last longer than is necessary, and that the provisions are proportionate to deal with the outbreak and its effects. There is also the Health Protection Coronavirus Restrictions England Regulations 2020 as amended, and there have been several amended versions of those. The Health Protection Coronavirus International Travel England regulations, and the wearing of face coverings regulations as well. But in addition to the legal regulations and acts, there is a HM government sector specific guidance. Initially, 8 sets of sector specific guidance were issued by the UK government, and as restrictions began to be lifted, more and more sets of guidance were issued. But the easings of restrictions have seen review and revision of these sets of guidance and additional guidance. Now we have offices and contact centres, construction outdoors, factories, plants and warehouses, shops and vehicles, restaurants, for example. Essentially, as sectors open up and become available for people to use, then sets of guidance get issued. But specifically to the local council scenario, we have guidance that's been issued specifically for council buildings and multi-purpose community facilities. These community centres, village halls and other multi-use community facilities support a wide range of local activity. However, their communal nature also makes them places that are vulnerable to the spread of coronavirus COVID-19. Managers of community facilities have discretion over when they consider it safe to open for any activity permitted by legislation, and may decide to remain closed if they're not able to safely follow the advice in the relevant guidance to make the space COVID-19 secure. The risk assessments that should be undertaken with regards to any premises which are going to be used for council meetings should follow the general principles of prevention. which are avoiding risks, evaluating the risks which cannot be avoided, combating the risks at source, adapting the work to the individual, especially as regards the design of the workplace, the choice of work equipment, and the choice of working and production methods, with a view in particular to alleviating monotonous work, adopting and adapting to technical progress, replacing the dangerous by the non-dangerous or the less dangerous, and developing a coherent overall prevention policy, which covers technology, organisation of work, working conditions, social relationships, and the influence of factors relating to the working environment. You also need to consider giving collective protective measures priority over individual protective measures. As an example of this would be not holding the meeting at all, as opposed to holding a meeting and expecting people to wear their own personal face coverings, and giving appropriate instructions to employees. So that's the general principles of protection, which are detailed in the Management of Health and Safety at Work Regulations 1999 as amended. These have been taken, and there are numerous acronyms or mnemonics to recall the hierarchy of control that should be introduced into the risk assessment. And the acronyms such as ESCAPE, ERIC PD, PIGS RISE, reading from the bottom, all vaguely similar insofar as eliminate and substitute are at the top and PPE is at the bottom. However, all risk assessments will need to apply with the principles of prevention as previously detailed and mentioned in the Management of Health and Safety at Work Regulations. So why in-person meetings? That's a good question, especially in view of the recently new imposed enhanced restrictions in Greater Manchester, Oldham, Kirklees, Leicester, Blackburn and Darwin. To be honest, I'm struggling to find reasons for in-person meetings. COVID-19 guidance for the safe use of multi-purpose community facilities, last updated 31st July 2020, and all other sector-specific guidance state remote meetings should be held in preference to in-person meetings. Parish council meetings were very much in a grey area here, certainly until this last week. However, with the introduction of the local authorities and police and crime panels, brackets coronavirus, brackets flexibility of local authority and police and crime panel meetings, brackets England and Wales, brackets amendment, and that's the important bit, Regulations 2020, which came into force on the 1st of August this year. Regulation 3 of these amended regs states that parish councils in England are included within the definition of local authority in the 2020 regulations, but also that the amended regulations add parish meetings constituted under Section 13 of the Local Government Act 1972 to the local authority definition. Essentially, these amended regulations allow parish council meetings to be held remotely. That's for the now, but who knows what amendments are going to take place in the future. Just to be clear, the NALC and the SLCC position is that face-to-face meetings are not recommended and virtual meetings should be the first choice. As previously stated, I am struggling to find justifiable reasons for in-person meetings, but for the sake of a balanced view, I will try. Parish councils may be unable to use video or telephone conferencing technology. They may not have it. There could be a reasonable business or legal need to meet in person. Few and far, I would have thought, the argument that we've always held in-person meetings doesn't hold any water here. So what justify reasons why we should not be holding in-person meetings? There could be a lack of suitable premises. Do the premises allow for effective social distancing? Is there a suitable risk assessment for the premises, whether it's owned or managed by the council or other owners? What about the age, health, and protected characteristics of the meeting attendees? Are they over 70? Are they clinically extremely vulnerable, clinically vulnerable? Do they have protected characteristics? Are they persons with symptoms or are they asymptomatic? Persons who should be in self-isolation or quarantine? You won't know, and if you ask, you might not be told. Hands, face, space, in accordance with the government's latest catchphrase. Hands, let's look at asking everybody on entering and leaving to wash hands thoroughly for 20 seconds using soap and water. Obviously the venue will need to have some adequate facilities or provide hand sanitizer if they don't have hot water and soap available. Consider holding paperless meetings. If papers are provided, people should be discouraged from sharing with others and asked to take the papers with them at the end of the meeting to minimize how many people handle them. Face coverings, asking people to wear them. We have to wear them now in shops and in other places, so why not in meetings? And social distancing and capacity. Consider staggering the arrival times for staff, the councillors and members of the public, ensuring seating is placed at least 2 meters apart, and arranging it so that people are not facing each other directly. Risk assessments, they have to be done. They are ordinarily required by existing health and safety law, and there is specific requirement in COVID-19 law and guidance. There are a number of considerations detailed in the guidance, some of which I'll highlight. Access and egress. Making use of multiple exit and entry points to introduce a one-way flow in and out of the premises. Having appropriate floor markings or signage. Any changes to entrances, exits and queues should take into account the need to make reasonable adjustments for those who need them, such as people with disabilities. Managing the arrival and departure times of different groups so as to reduce the pressure at exits and entrances. Queue management, the flow of groups in and out of the premises should be carefully controlled to reduce the risk of congestion. It may be necessary to introduce socially distanced queuing systems. Talking about the risk assessment, has one been done? If so, is it suitable and sufficient? Has the maximum capacity of the venue been determined? If there are over 30 persons, the venue has to be COVID-19 secure. Suitable and sufficient with risks reduced through reasonable and practicable controls, as low as reasonably practicable. Suitable and sufficient here doesn't have to be perfect. The controls do, however, need to be proportionate to the risk. Reasonable and practicable is the balance of the risk on the one hand against the time, cost and effort to control it on the other. So controlling the risks and becoming COVID-19 safe. Cleaning. All surfaces, especially those most frequently touched, should be cleaned regularly using standard cleaning products. Using somebody else's premises, have they been cleaned? If so, how thoroughly? Has anybody been in the premises since they were cleaned? Things you don't necessarily know. Hygiene and face coverings. On entering and leaving a community facility, everybody, including staff, should be asked to wash their hands thoroughly for at least 20 seconds, using soap and water, or using hand sanitizer if hand washing facilities are not available. In England, face coverings are currently required by law to be worn in shops, supermarkets, indoor transport hubs, indoor shopping centres, banks, building societies, the list goes on. From 8th of August, face coverings will be required by law to be worn in a greater number of public indoor settings, including museums, galleries, cinemas, places of worship and public libraries. While not legally required for meetings, wearing of face coverings should be mandatory for in-person meetings. Ventilation. Does the venue have good airflow? Can windows and doors be opened to increase airflow? Using hand signs and posters to build awareness of good hand washing techniques, the need to increase hand washing frequency and to avoid touching your face and to cough or sneeze into a tissue which has been safely, or the crook of your arm if a tissue is not available. To enable good hand hygiene, consider making hand sanitizer available on entry to toilets where safe and practicable, and ensuring suitable hand washing facilities, running water, liquid soap, and suitable options for drying, paper towels or hand dryers are available. Setting clear use and cleaning guidance for toilets with increased frequency of cleaning in line with usage. Using normal cleaning products, paying attention to frequently hand-touched surfaces, and consider the use of disposable cloths or paper roll to clean all hard surfaces. Vulnerable people. Certain groups of people are at increased risk of severe disease from coronavirus, including all people aged 70 or over. Such individuals are advised to stay at home as much as possible, and if they do go out, to take particular care to minimise contact with others outside of their household. Seating, ensuring social distancing guidance are followed, 2 meters or 1 meter with risk mitigation. The maximum safe capacity should have been determined. Avoiding face-to-face seatings, allowing adequate space for people to move around, and ensuring that pinch points are controlled. So moving on to the NALC and SLCC checklist and what, why, and how. So what is it? Well, it's a detailed list of actions to be taken to ensure the in-person meeting is safe and is required to be completed and submitted before it's approved or not approved for the meeting to be granted or not. Why is it needed? In-person meetings need to be safe. The checklist is required to be completed, submitted to the council, who will consider whether it is safe to hold the in-person meeting. And how does it work? Well, each item on the checklist needs to be completed. The first check is whether the meeting needs to take place at all. I might remind you here that the NALC and the SLCC strongly advise councils to meet remotely. Before starting to complete the checklist, the question needs to be asked, do we need to have this meeting? If the answer is yes, have all possible means and ways of conducting the meeting remotely been explored? If the answer is yes, and an in-person meeting is required, then you need to complete the checklist. However, you need to be extremely vigilant and mindful of the risks. We all know COVID-19 is a potential killer. The disease spreads primarily from person to person through small droplets from the nose or mouth, expelled when a person with COVID-19 coughs, sneezes, or speaks. These droplets are relatively heavy, do not travel very far, and they quickly sink to the ground. People can catch COVID-19 if they breathe in these droplets from a person infected with the virus. That's why it's important to stay at least 1 meter, according to the World Health Organization, away from others. These droplets can land on objects and surfaces around the person, such as tables, doorknobs, and handrails. People can become infected by touching these objects or surfaces, then touching their eyes, nose, or mouth. So before deciding on whether an in-person meeting is required, can you be certain that such a meeting will be safe? Even if all of the questions on the checklist are positively responded to, what control is there over people attending the meeting? People are human. Humans make mistakes. Someone with symptoms or asymptomatic may attend the meeting. This is uncontrollable. If there are any doubts, then the person meeting should not be held. Thank you.